Good morning. Good morning, good afternoon, good evening, everyone. Thank you very much for joining our webinar, wherever you're joining from. My name is Dr. Olga Zaitz, and will be facilitating today's webinar. So the webinar today is an end of project webinar. 2 years ago, we were very fortunate to secure some funding to investigate the impact of COVID-19 on graduates. So those graduates who were transitioning to the workforce during this difficult time. Together with me today are presenting several other team members. I will introduce the project very briefly. This will be followed by the presentation by Dr. Zoe Fortune, who will speak about, Zoe is a clinical psychologist, and she'll speak about graduates' mental health. And Zoe is joining us from Dubai. Dr. David Edmonds, who is the postdoc on the project, will talk about workplace skills during the pandemic. And our presentation on the project will be concluded by Dr. Pauline Luc, who is in the medical faculty in Hong Kong, at HKU. She'll present a case study, positive impacts of the pandemic on medical graduates. We are very fortunate today to have with us Ms. Hilika Vanosh, who is the CEO of City Mental Health Alliance, one of our collaborators on the project. And Hilika will present us with a workplace perspective on graduates' mental health. So without further ado, so I've mentioned already that we've been very fortunate to secure some funding from Research Grants Council. This is called collaborative research funding. And we wanted to focus specifically on graduates transitioning to the workforce during the pandemic. And this is a very important topic because we know from the literature that graduates' underemployment and unemployment has very severe consequences. So it's related to high economic and social cost, lower levels of civic and social engagement, individual ill health, including mental health. During the pandemic, graduates were one of the most vulnerable groups in the workforce. And this is because we know now from our own research, but also from research by others, that they face significant mental health deterioration, reduced and different employment opportunities. For example, those industries that they originally planned to work in were not hiring. There was a reduced number of internships. Many had to consider further education rather than transitioning to the workforce. And they also had to deal with changed work orders. For example, hybrid working, increased use of technology, including AI, and different required skill set. So the team that came together 2 years ago included colleagues with expertise across different disciplines: sociolinguists, psychologists, HR manager specialists, people working in education, public health, economics. Our team is cross-institutional. There are 3 universities here in Hong Kong and a university in the UK, so we're also international. Right from the start of the project, we've taken a participatory approach. We've involved graduates as the main group of stakeholders into every stage of the project. Half of our team are recent graduates. They're hired as support staff. We've also invited graduates to join our advisory board. And we've very recently created a new internship program to give graduates or soon-to-be graduates some employment opportunities and some employment experiences. So other stakeholders have also been involved quite heavily in the project. So we worked closely with employers, HR and line managers, and also university staff, academic, teaching, career, and placements. In the project, we've managed to collect a large corpus of novel quantitative and qualitative data. We've conducted surveys and interviews with the 3 groups of stakeholders who I've just mentioned. And we've also developed our own approach, methodological approach, which is based on amalgamation of research methods from psychology and sociolinguistics. And we did it with the purpose of examining the lived experiences of our participants, while also attending to broader context and trends. So these are our major findings in a glimpse, and each of the presentations to follow will focus on each one of them in more detail. So we've seen very concerning levels of symptoms of ill mental health, depression, anxiety, stress among our graduates. Quite concerningly, graduates were not confident to talk about their mental health with university staff or in their workplaces. And we've discussed it in one of our papers that this may likely be linked to mental health stigma, which is still rife in Hong Kong. Both graduates and university staff talked about mental health support not being readily available. And quite surprisingly, this came as part of our work on, or our presentation of our work on social media, is we've discovered that there is quite a lot of prejudice against young adults in the workplace and broader communities who are perceived as entitled. And we strongly believe that work to debunk these prejudicial attitudes is needed, because mental health is not an entitlement. With regards to graduates' skills, there was a clear mismatch in the required versus possessed skill sets between employers and graduates. For example, there was a deficit in soft skills in the opinion of employers. Concerningly, there was also a mismatched perception as to whose responsibility it is to equip graduates with work-related skills between university staff and employers. Graduates' own perceptions of preparedness for the workforce differed from employers' perceptions about their awareness about and knowledge of the workplace. And to finish on a more positive side, we did a nested study on medical graduates. And surprisingly, many of them talked about positive impacts of the pandemic. They've quite enjoyed online learning that was beneficial for preparing them for the workforce. And also the pandemic gave them the opportunity and equipped them with skills to face future pandemics. So this is in a glimpse. And now I'm passing on to Dr. Zoe Fortune, who, for those of you who joined us later, is joining us from Dubai. She is the main clinical psychologist on the project, and she'll talk about our findings regarding graduates' mental health.
Hello, everyone. Thank you, Olga. And my apologies. I do hope you can all hear me. I have a bit of a croaky voice today, so I will talk a little bit briefly. So the graduates' investigation on mental health, we started off really by trying to understand the landscape and what is known about graduates' mental health. And I think that the scoping review was very clear that much of the work was conducted prior to the pandemic. And obviously, as you will all know, much changed throughout the pandemic. And I think we're now talking in a pre and post-pandemic world when it comes to things like mental health and also workplace transitions. But also what was very interesting about the research is that most of it was coming from the USA and Europe. And actually, I think a lot of the research, the grey literature, also comes from the area of the USA and Europe. And there is a deficit and a lack of research and understanding in Asia and in Hong Kong specifically. So we really wanted to understand what was the need, mental health need amongst graduates. And also, as you will be aware, there has been an increase in general in mental health concerns and issues of mental health concerns and issues in students in general throughout the global population, but we really wanted to understand what this was specifically in our graduates and student population. So, thank you, Olga. So we very simply asked our sample to complete a standardized questionnaire known as the DASS. So it measures depression, anxiety, and stress. Now, these are scales that give an indication, but please note that these are not diagnostic scales. We are not diagnosing anyone. This is just to give an indication of what people are experiencing. And as you can see, we noticed that there were really high levels of depression and anxiety that could be in the severe to extremely severe end. And these are concerning levels amongst young people, and these are higher than population averages and population estimates. We also noticed, sorry, Olga, if you could just go back a second. We noticed that these were particularly high in the group of graduates who were transitioning into the workplace in 2021. Now, we're investigating a little bit more of some of the reasons behind that. But as you can see, those graduates who were entering the workplace during this time are particularly stressed and particularly high on those levels. But also, we also asked about diagnoses, and we noted that many of those who are reporting these scores were not receiving a diagnosis of mental health and mental ill health. And maybe that's to do with some of the reasons that Olga noticed around stigma, but maybe it's also to do with some of the reasons that I will come on to talk about in a moment in terms of lack of awareness around where to get help and support. We can move on, Olga. And so one of the things, first of all, is really trying to understand how confident people feel to reach out for help and support. And we asked graduates and students in different places, so whether they were at university or whether they were in the workplace, how confident do you feel that you have someone in your life or at work or in the university that you can talk to about your mental health? And you can see, I hope you can see, the light blue is in your life, the grey is at university, and then the dark blue is in the workplace. And it goes from not at all confident to extremely confident. And so what you can see is that, generally speaking, people feel confident-ish that they have somebody in their life that they can talk to about mental health, which is good, but there's definitely room for improvement. In the university, there's a real range. Some people feel confident, some people don't. But when it comes to the workplace, most people are saying they do not feel confident to speak to somebody in their workplace. And this isn't defining whether they're speaking to a manager or a colleague, because we know there is evidence that actually people feel more confident in speaking to a colleague than a manager. But this is in general. And that shows that graduates are experiencing high levels of mental ill health, but when they do get to the workplace, they are not reaching out for help and support, and that's concerning. However, having said that, so this is kind of what we were finding in the quantitative data. We're noting these things, but we also found in the qualitative interviews that there was this other side, if you like. There's another side to this story. And the other side to this story was that some people were saying that actually during COVID, they weren't experiencing mental ill health. Now, I've discussed this, and there might be some reasons behind some of that, whether people don't have a comparison or perhaps whether they didn't realize, but actually people were saying, actually, I didn't feel that it was any different. And some of those reasons could be because people felt that they were able to take up other things that they weren't able to do during normal times. And we'll come on to some of the positive impacts of the pandemic in a little bit later. So we've got a little bit of a mismatch in what we're hearing from our qualitative and our quantitative data. But I think we can think about it as two sides of a coin. We are noticing these problems, but again, there are other people who didn't feel that there was this huge problem during COVID. So we also asked about the support that was provided in the workplace and also universities to young people. And some felt that the support services provided by universities were extremely helpful. And we know that universities, and we asked a different range of students across different universities in Hong Kong, and we know that universities provide a range of different resources, from counselling and psychologists through to information and kind of helplines, if you like. But there were a couple of clear challenges that came up that are preventing some of the access for young people. One of which is the framing, the way that the service is framed to the student. And some of the students were saying that they almost didn't feel that they were ill enough, or that they were the right person to be accessing that service. Are they worthy to be accessing that service? And we know from the literature that actually the earlier you intervene in any mental health challenge, the better it can be. And so this is a problem because it means that young people aren't reaching out for help and support at the time when they really should be reaching out for help and support before it becomes a real problem. And the other thing is around promotion. And so the way in which this is articulated, so if it comes out in a mass email, it might be that somebody misses it, or it might be that actually they don't need that help and support right now, or they feel it's not for them. So what this says to us is we just need to get a little bit more strategic around thinking around how do we promote these services that are available, and around the time and the students can engage with them and make sure that they're easily accessible. So the other thing that students were finding, given that they weren't reaching out for help and support, was saying, well, we need to rely on ourselves, and that actually it's up to us. So people aren't reaching out to us to say, is everything okay? It's up to us to self-refer. Now, on the one hand, that can be a positive thing because of autonomy, etc. But on the other hand, we also know that when people are experiencing mental ill health, reaching out can be something that's very, very hard to do. And also there are challenges around stigma and around perception. And so we also found that there was a need to identify what is the correct way of communication? How do we best strike this balance between students reaching out and having that level of autonomy, but also people reaching out to them and ensuring that the burden of care is not always with the student, to ensure that they can get the help and support that they need. So we also asked who is responsible for support. And this was a really interesting question because we were asking workplaces, but just to highlight some of the findings that came up from universities. We found that university staff were saying, well, I'm not sure whether mental health support is actually part of my job or even if I am trained to do it. And so this obviously comes down to, where is the line? Where is that boundary of support? And recognizing that faculty staff, support staff within university may not be the right people, and they also often don't have the right training to be the right support service for somebody, but they are often the first port of call. They are the ones that will often engage with the students. So how do we ensure that staff feel that they have the right information at the right time and they have the right training and the right support services in order for them to be able to offer appropriate levels of support to the student, and that the university is promoting well-being in an effective way? When it came to staff, they found that there were minimal resources given to them as well. So if we're thinking about the workplace and we're thinking about whose responsibility is it as well, often, there might be an EAP service, an employee assistance program that's out there, and I'd be interested in hear Hilika's note on this a little bit later, but it might be that they're given a website address or an email, and university staff as well, that they could give to students if they're in a crisis or those who are in the workplace. And we encourage, university staff were saying, we encourage them to seek help and support, but there just wasn't enough out there. And as I've mentioned, there's a grey area in terms of responsibilities, in terms of the workplace and also in terms of the university staff as well. So what we are really seeing is that there is, as Olga mentioned right at the start, there is a concern around the mental health needs of young people and of graduates who are in university and those who have moved on into the workplace. Mental health needs during COVID and beyond COVID. And we're seeing high levels of stress, anxiety, and scores that might equate to a diagnosis of depression. But what we're also seeing is that there is this complexity around how graduates and young people reach out for help and support, that they don't necessarily feel that the help and support mechanisms they are able to engage with, perhaps they're not publicized in the right way, or perhaps there's this fear of stigma and these associated implications. On the other side of that, we're also seeing that staff, that university staff, don't quite know where their responsibility lies. Do they feel trained? Do they feel adequately supported? And perhaps there's a little bit of a grey area around, well, when do I signpost to appropriate levels of support? And when do I help that young person in the best way that I know how? So the findings point to a need to support graduates in finding opportunities and their ability and confidence to reach out for help and support, and be aware of what those resources available to them are. We also want to continue to investigate, well, how do these mental health needs, do they continue to persist? How has COVID changed the reality? We know that COVID's changed the reality of the workplace. In what way has it changed the reality of mental health? And what are the experiences that have happened to graduates along the way? And I will hand over to David to talk a little bit more about the skills required from graduates. Thank you.
Hi there, everyone. So, yes, as Zoe said, my name is David, and I'm going to talk about skills in the workplace, which is mainly drawing upon our published paper in industry and higher education, as you can see in the corner there. So, as a background, we know that COVID brought about the rapid technologization of education, so Zoom and other forms of technology, and a lot of hybrid working for workplaces, whether that be working from home or e-commuting. Now, obviously, through this, there is the need for graduates and those heading into the workforce to be proficient in these technological aspects, or what are called hard skills. But then also, on the other hand, there's the need for graduates to be proficient in soft skills, or what are more communicative strengths, such as communication and collaborating with their colleagues, because they're going to be communicating quite often with colleagues in a hybrid setting, with colleagues that are elsewhere, maybe not even in the same country as them. So just to give a brief overview of our data, we had interviews with 41 employers and 69 students and graduates. And basically what we found were four key themes. The necessity for students to have hard and soft skills, a disjuncture between university and the workplace, graduates demonstrating strengths in hard skills, and graduates having a deficit in soft skills. And we will address each of these in turn now. So, we found that graduates and students need to be proficient in both hard and soft skills. So, as this graduate here said, there's the importance for graduates to have skills such as leadership, initiative, and teamwork, perhaps not surprising. But then on the other hand, they also need to have business acumen, which is, for this graduate, within their industry of accounting, and technical skills, whether that be something as simple as Excel or more specific to that industry, such as coding, for example. We also found that there was a disjuncture between the university and the workplace. And what we meant by this is we found that graduates talked about the skills that they gathered in university, not necessarily transferring to their jobs. So the skills that they learned about how to study might not necessarily help them that much in their job, because they're not going to be, it's a different kind of learning environment. And also that there's different expectations and requirements of the workplace compared to university. Essentially, that studying and learning are two very different things. We also found that students were seen as having very strong hard skills. And this is perhaps not surprising, given that as a result of online learning, students were dealing a lot every day, essentially, with different kinds of technology, whether that be Zoom or whether that be other technologically based platforms such as Blackboard or Moodle, and even within that, other things. For example, we know that a lot of the medical students were doing online training through simulation, so they would obviously be very proficient with that sort of software. And as this graduate said, because of COVID, I'm able to use Zoom without any trouble. And as a result, it was relatively easy for them to adjust to hybrid working. So they pretty much went into the workplace with very little to learn in terms of their hard skills. However, both students and employers were telling us that students had problems with their soft skills. Students saw their communication as weak because of the limits on face-to-face learning. Essentially, they were only communicating with their classmates and doing group projects over Zoom, or through chat systems like WhatsApp, or chat-based forums on things like Moodle. And so, as this graduate said, where we were forced to study online, and COVID forced us to develop skills where we had to concentrate at home. I don't think I can apply a lot of these skills when I do graduate, because I will have to interact with other people. I will have to learn how to communicate with people in real life rather than through emails and online. And employers also complained about weaknesses in students' soft skills. with this employer noting a huge drop-off in the quality. And in fact, employers were talking to us about having to invest in upskilling and training their graduates that came into the workforce in soft skills. So as this employer said, we're going to have to increase the amount of training and mentorship we give to people to kind of fill that gap. So in post-COVID-19 workplaces, there are going to be hybrid modes of working. You're going to be in the office, or you're going to be from home, or maybe not even in the same country. And these hybrid modes of working are going to need hybrid skills. So students and graduates are going to need to now be proficient with various technological skills, as well as being able to communicate effectively through email and other forms of electronic communication. What we would suggest and recommend is that there's a thorough incorporation and embedding of soft skills into the university curricula. And this is not just getting students to do a presentation at the end of the semester. This is incorporating soft skills throughout the semester, throughout not only your teaching, but also your assessment as well. And this will enable the burden to not be entirely placed on workplaces to train and educate their new employees. Future directions, obviously we know that hybrid working is here to stay, but does this mean that hybrid skills are stuck, and are they here to stay? How might they have also evolved? And especially within the last year, we've really seen the impact of artificial intelligence, especially now, and a lot of us in education are now dealing with ChatGPT generated assignments. So where does artificial intelligence fit in with these technological skills? What do workplaces expect of new graduates? Do they expect that graduates can use ChatGPT and all these other forms of generative technology, or are they themselves, that is the workplaces, still figuring out how to use that themselves? And now I'll pass over to Pauline, who will do the case study.
Pauline, you're on mute.
Sorry. Yeah. Hello, everyone. So I'm actually writing on the big research projects. We have a subset of analysis on medical students, and we after the interviews we have like identified some very interesting observations. Is that actually COVID brings some positive impacts to the medical students, and as we all know that impact of pandemic is generally saying that a lot of negative impacts, like sitting too much at home, and you might have obesity, distress, or social isolations. And even for the study on medical students, it also say that it brings more anxiety and stress to medical students. But in our study, we interviewed 16 medical students and graduates. Most are new graduates, and they are from 2 medical schools in Hong Kong. And we used thematic analysis to analyze their in-depth interview. And we identify some interesting points is that the pandemic actually bring 4 areas of improvements in their professional and prepare them for their future career. First is about learning, and then also it brings some professional developments, advantage, and also improve their relationship as well as personal growth. So as I know that today, I only have like 5 minutes to share, so I will summarize some of very interesting highlights. First is about learning. So when we think that, during the COVID, many of the students are focusing on Zoom or using the online, actually the students comment that the advancing of using online learning is helping them a lot. And they find that they can have more variety of learning through the online courses, or they can do quizzes on the online. And they recognize that some of the students comments that they think medical school are rather traditional, But with the advancing of the online learning, they find that they benefits from this experience. And I think through their reflections, they can understand the needs of advancing in their future career as well. And then for the students, they also equip, through the online learning, they equip themselves with skills that can prepare for their future. One is they know more how to organize their notes because they have more times to spend on the computer, and they know how to do screen cap. So in the past, when they're sitting in the classroom, students say that they take notes. But now with the PowerPoint slides on the screen, they just need to do the screen cap and save time for them. And also, in particular, some of the interviewee, the participants, mentions that they admit they are relatively slow learner and they have the opportunity to replay the video, and this can help them. And also, we have some students, they are fast learner, they will speed up their watching the video to the speed of like 2 times. So they have more time to study. So this kind of using different way of using online learning can help them to gauge how to have a better time management skills, or helping how to work smartly. And then another level is that they also recognize that the flexible learning arrangement is good for them. And also, they also find that it is very good opportunity to get reach to the online resources. And one of the students mentions that he spends some time to do distant learning. And at the beginning, he thinks that distant learning might not be as good as face-to-face, but as the pandemic bring a new experience to him, and then he can see that distant learning actually has the equal weight. So not only these participants, we have some more participants, they spend more times to find deeper knowledge and pursue some more quality programs to enrich their learning experience. And of course, through the online learnings, they also find some new pedagogies. For example, during the pandemic, some of the medical schools, they train patients as patient educators. And this experience allowed the students to interact with patients more directly through online and more flexible. And also, students find that the bite-sized learning is more approachable for them. And also, students are using ChatGPT to learn knowledge, and they are trying to use the ChatGPT to help them to answer, and then they spend more time critically to analyze the answer and helping them to check out more information. And also, once as participants mentions about that during the pandemics, they have the development of self-arranged study group. And actually, this echo with what's happening on the ground is we have medical schools, they establish more peers learning. So they have peer teachers to teach the senior teach the junior students. And this innovative pedagogy actually encourage the students to think more innovatively for their work in the future. And also, there are more online resources, and they share seniors' notes for their junior students. And for the next one is the professional development. And the students actually, through the pandemics, they find more better direction, career directions, because they have opportunity to explore the future career. So some of them find that they are more interested in research. Some of them find that they are more interested in technology. And then some find that they need to think about their priority and values as well. So this example and reach of the different aspect of medical professional, help them to plan for their future directions as well. And also because of the pandemics, they also have like the readiness for the future pandemics. And because in Hong Kong, the students has an opportunity to work in those COVID testing centers, and they learn how to put on PPE earlier than other years, because in the past, they might need to do this in the clinical years. And also they have interprofessional collaborations with nursing colleagues in real settings as well. And then for the next is about the relations, and they find that they have more time and they value more the interactions with others. And these soft skills are very essential for their future careers as well. And last but not least is the personal growth. So they find that they have more time to do self-reflections. In the past, many medical students are very hesitant to do reflections, but because of the pandemics, they have more time, and then they can slow down and contemplate on understanding their own needs and values. This can help them to plan their career better. So as conclusions, we find that this kind of experience can actually help the medical students to prepare better for their future. Even some of the experience might not be 100% positive, but they can convert and think positively how these restrictions can help them prepare for their future professions. Okay, this is what I want to share today. Pass back to Olga.
Thank you very much, Pauline and David and Zoe, for presenting on some results of the project. So I wanted to just very briefly talk about where we go next. We were quite fortunate to secure further funding for the project, and obviously COVID is now over, and the big question is, what are the long-lasting impacts? So probably everybody will agree that both universities and workplaces have changed dramatically. I haven't taught for the last 2 years, and this was the first semester when I did some teaching, and I could see the difference in students. I could see the differences in their soft and hard skills, how they were finding it very difficult to engage in the collaborative work and the teamwork. So we've begun, this wasn't the focus of our project in the seed-funded project, but we will now throw more attention and resources into developing a virtual hub, which we've called Graduate Mind Map. So after we finish our webinar, please visit it, and if you have any suggestions or you would like to contribute to it, do let us know, reach out to us. So we've sort of envisioned this Graduate Mind Map Hub as a one-stop resource that will provide students, graduates, professional student services, colleagues, and university staff with support resources in relation to core skills and competencies for post-COVID-19 workplaces, and also mental health resources. We began to populate this digital resource with infographics, video resources, podcasts. You can see some of the examples here. These are available on YouTube, but you can also find the links on the resource. Over the summer, we will have 3 interns working with the team, and one of the things that the interns will be involved in is developing bite-sized mental health resources and bite-sized resources for development of key skills. We're planning the new project, besides developing the Graduate Mind Map, to focus specifically on post-COVID-19 workplaces. So we will collect a new set of data, so with the same 3 group of stakeholders, but with the focus of, now that we've moved out of the pandemic, where we are. So we look at mental health, we look at main skills, we look at workplace requirements and graduates' preparedness. We're also expanding the project to GBA area. For those of you outside of Hong Kong, this is Greater Bay Area that includes a number of cities, neighboring cities to Hong Kong, such as Guangzhou, Macau, Shenzhen. This is a program that was introduced by the Hong Kong government. It's a youth employment program whereby graduates from Hong Kong universities could also find employment in GBA area. So it's sort of part of our interest in not only, you know, the negative impacts of the pandemic, but also the opportunities that have been created for graduates. This was mentioned by David, but it's sort of like a big elephant in the room. And I've noticed again, it's with my students that increasingly everyone is using AI and trying to sort of keep up with the times. We asking the question, what's the ethical use of AI? What should universities train the students in? What's the place of AI in? Obviously, different industries will use it to a different extent, but we are not sort of hiding away from it. But we would want to look at we want to look at it in more detail. I would like to now invite Hilika Vanosh, City Mental Health Alliance CEO, who's been our collaborator for the last 6-7 years. And Hilika will present the perspective of the employers. Sorry, Hilika, if you give me a minute, I'll open your PowerPoint. There it is. Okay. So give me a signal when I need to move from slide to slide.
Okay. Do you want to make it full screen? I'm not.
Yes, it is. It should be full screen. Yeah.
Yeah. It's just the delay, my slow Wi-Fi. So I hope that's okay for the audio. And thank you, first of all, very much for inviting me. And it's been great to work alongside with you and collaborate with you on this really important project. So if we go to the next slide, I'll just give people a little bit of background about who we actually are. So City Mental Health Alliance is a member-based not-for-profit organisation. We started off in the UK in 2012 and were established in 2017 by Dr. Zoe Fortune, and she laid an amazing foundation for the ongoing work that we've been doing. So what we basically do is we're a not-for-profit. I don't know if I mentioned that. And we really comprise just with our member organisations. As you can see at the bottom there, we have 27 member companies in Hong Kong that cover, you know, the broad range of the corporate areas, legal, financial, insurance. And we have also Swire, Jardines and MTR, who are sort of bunch into that conglomerate bundle, but they're all very individual in their own ways. So essentially what we do is we support organisations to create more mentally healthy workplaces where their employees can thrive. So the credo being so along the lines of that employees can thrive and not just survive within their workplaces. And that has always been an important issue, even pre-COVID as well. But I think COVID has brought with it, obviously, some very distinctive and extreme pressures on both the managers and leaders within the corporate sector and definitely the new graduates that are coming into it. Just a fraction, sorry, I'll just quickly go through this. So basically, yes, like I've said there, so we do that by creating those resources. We try to raise mental health awareness across all the levels of the employees. We really see that leaders have the job of setting the tone from the top. And we really rely on them of percolating that down through the old trickle down effect. I don't know, hopefully it works in mental health. Managers who are in that middle layer of the cake, who get pressure from both ends, they need a lot of support in being able to meet the expectations of their leaders and to support their direct reports. And the general employee group, we really work with them just to raise their awareness. So, and we do a lot of member and public events. Because a lot of our organisations are multinational organisations, there's a real sense that we also need to give back to the broader Hong Kong community who can't necessarily join us as members, but who we have a responsibility to provide resources to. So a portion of the stuff, the materials that we create are directed very much at all Hong Kong organisations, and we make them available in both English and traditional Chinese. And it's a way for our member organisations to share the wealth of our knowledge. And we also do events where those member well, also non-members can come together and share experiences and make connections with like-minded individuals, because, you know, as we've seen in the discussions that we've already had, this is a bigger issue than any one organization can deal with. So it really needs all of us to pull together. Thanks, Olga. So I just wanted to share with you just a few little tidbits of what member organizations have come to us with their insights. So they've definitely noticed that new graduates are less willing to ask for guidance and to report issues. This was particularly raised for us in a roundtable discussion that we had with some of our legal members, where the comment very much amongst the partners, but also some of the more senior associates, was that they would give people tasks and their junior associates a task, and rather than coming back and asking for help or assistance or guidance, they basically sat with it and just did not know where to go in as far as so that the confidence to ask, the confidence to initiate those conversations, was that being able to build a relationship with someone who has a sort of a more senior to you was something that was lacking. And that's what I've said in that point too. But the other issue that was also something to think about was that new graduates also lacked the interpersonal skills to collaborate even with their peers. So it wasn't just that they were finding it hard to have conversations with their managers, but it was also in as far as if they were a cohort of new grads that, you know, they were used to working in their own spaces with their own mindset. So moving into from a university linear mindset where you're concerned with your own scores and your own essays and passing your own exams, to being in a collaborative environment where you all participate and you can't hold others up because of the sort of not being able to meet your timeline. So it was really felt by a lot of our member organizations that new graduates have these responsibilities. Also, one of our trainers, Kimberly Ho, is someone who is a in-house mental health counsellor. Sorry, thanks, Olga. And she also found in her conversations with new grads within the workplace, so she is in-house, so she's employed by an organisation, by a company, mostly legal companies, to offer counselling services for the staff. It's purely done on it's anonymous, but it's in-house. So it's twofold. It gives, it shows that the organisation supports the provision of mental health services. It offers employees this service within the workplace, so it's easily accessible. And it gives them what Kim is able to do is on a monthly or bi-monthly basis, share those top line issues of what she sees are the most common talked about areas of stress, anxiety, or mental ill health of the people that she sees, obviously keeping it totally anonymous. And what she will then sometimes also do is prepare a short training for those people for topics that are particularly relevant in that workplace. So that's both new graduates and employees within that workplace. But I see that as being a really important part of providing the information and the resources that are needed by people in sort of real time. So I think that's a valuable insight. So if we go to the next one, as a result of what our member organisations had seen, one particular member company came to us and asked us to create a training module to support new graduates. So this is something that we look to really improving on and enhancing with the research findings from the Hong Kong U research program. And I think there's a lot that we can do and will continue to do working together. And a lot of that workshop also used breakout sessions and other interactive exercises to encourage those new grads to share their experiences with their colleagues. And that was as part of, you know, trying to break down those silos and create a more sort of collaborative environment amongst this cohort, because it often would be a cohort of new graduates within an organisation who are coming together to do this training. So we've done that for a few legal firms, and also for one of the big conglomerates who is a member organization. So I can just share with you, next one. So this is just so you understand, these are the things that we cover in that session. So it's really about understanding the challenges that they're facing as they transition to the workplace, ways that they can help to or skills, again, soft skills that they can develop in order to address their potential stress levels, or their, not just potential, but highly likely to have the stress levels. And also that soft skills are definitely things that you can develop. We have a resilience training module as well, and one of the key learnings from that is that you're not born resilient. It's something that you develop with time and with experience and with patience. So I think it's a really important lesson for people to be reminded of, and general mental health awareness definitely is something that's an essential part for that we see as for all of our for anyone basically. So as part of this session, next slide, thank you, Olga. We do these training I don't know if people are familiar with Menti, but one of the things we do is we ask them what things trigger stress for you in your first job. And if you're not familiar with Menti, the bigger the word, the more people say it. So this is just an interesting sort of reflection on what these new grads are saying as being the things that cause stress for them. So for this one, it's, unclear instructions, drafting. I'd say this is probably a legal firm by the terminology that's used. The expectations that could be of themselves and of others, research tasks, urgent deadlines, this feeling of I don't know anyone. I think one of the other ones says the imposter syndrome, which is also a topic that we cover in our training module as well. So it's really, there's so many new things for people. It's the acronyms that they come up with. It's with anything, acronyms are used to set people apart, and that's definitely something that new graduates, anyone moving into a new area of work, really struggles with. And then particularly when you're at the very bottom of the tree and having to draw up the courage to be able to ask those questions, I think it's a really difficult hurdle to overcome. I think if you're a new grad and you've not had the opportunity to work directly with maybe your professors and your tutors and so forth in a room, learn to go up to someone and ask a question. All of those sorts of things are the sorts of skills you could learn during what we have in the, showing my age, have taken for granted as part of the soft skill development that we had during a university course. And these are people who haven't potentially had that, knocking on the door of your professor to ask for an extension. There's a huge learning right there. So that's just one thing. And then the next one is really, we ask them what activities help you to release stress. So this is just, I just thought I'd throw that in the mix. Exercise, catching up with friends. I shared this with Zoe this afternoon, doing the work that is causing me stress and finishing the work. So obviously these are tasks that people are finding so big that they don't know how to tackle them yet, and they haven't got the confidence to go and ask for help for it. So, and this, the stress builds up, the timeline's coming ever closer, and you still don't know how to get ahead with that. So you watch some Netflix instead. But I think that's something to also bear in mind. So that goes back to managers as well, to give more guidance and to be sure to ask. I think that's one thing that we definitely talk with our manager training and so forth as well, is to gently ask those people in the room who are not asking, who are maybe, not confident to ask a question, to just gently sort of ask them, is there anything you want to contribute, or to have you got any questions? So that's really where I wanted to leave it. So that's what I can bring and share with you from the workplace.
Thank you very much, Hilika, and thank you for your time in joining the webinar today. So we moved to the last part of the webinar. I hope you enjoyed the presentation of our findings. So we've now started in early April the second leg of the project, which will be going until 2026. So we would like to hear from you if you have any suggestions or questions, or if you would like to get involved. The team are very excited that we can continue working on the project. So we'll open up the floor to questions now, and we've got quite a few questions in the chat. So I suggest maybe we can stay online for another 10 minutes. I suppose the first question from Jennifer Eagleton would be to Hilika. Are the training modules online or face-to-face? New graduates might want to do something online first. It might be hard to open up to strangers in a new workplace.
Great, thanks for your question, Jennifer. It can be done in either way. At the moment, it's mostly dictated by the organisation that has asked for us to deliver that training session. Quite often it is done in a virtual space, and particularly during COVID, when we were offering this, obviously it was done virtually, and we would do those virtual breakout sessions and so forth. What we did include in that was we made a short video where we had a past, a graduate from the previous year made a short video about, how she had overcome some of the obstacles and some tips of how to share and so forth. So that was something that we could then throw into the mix with these people. And I think that worked quite well with that. So that was something, so it is delivered online with a facilitator, but we've now done it in both. We've sometimes done it also as a hybrid. We have done one session as a hybrid where we had some offsite and some in the room. Did you have a question for me, Zoe? You raised the hand.
I just wanted to add something, if that's all right. Way back when, in 2018, when we first started doing these trainings with CMHA, one of the things actually was that people didn't, not just talking about graduates, but just in general, employees didn't necessarily want to or feel comfortable in talking about mental health in the workplace. And that was one of the changes that we are collectively aiming to affect. And so I noticed, just to your point, Jennifer, right at the start, that trainings that were delivered in person were really good for sending the message of, we really value this. But actually people didn't come because people didn't want to be seen to be the person that was talking about mental health. And so trainings that were offered online then became quite good because then people could dial in without having that physical presence. So I think we've moved on from that, but I think it speaks to the point around a couple of questions in the chat around ensuring that we are creating the right environment in which people feel safe and enabled to speak up about mental health concerns, whether that's an employee who's been there for 40 years or whether that's a new graduate coming into the workplace, or indeed, to one of those questions, graduates moving between workplaces. There is a responsibility to ensure that graduates are provided with awareness about where to go and get help and support, and that there is an environment in which people feel safe and enabled to do that. And I think the same with universities as well. It's around messaging, it's around information, as well as creating the right culture and just being aware of these kind of findings. And that's why we're so excited by this project, that we now have evidence behind a lot of the things that I think a lot of us already knew, but we have some of the research data that highlights these are concerns, and that we can now go back and say, well, how can we get better at addressing them? Sorry for jumping on your point, Hilika.
That's fine.
Thank you very much, Zoe. And Hilika, if you don't mind, I'll move on to the next question. Sure. This is a question from Stephanie Ng. I'm curious to know your thoughts on how parents and family members can support young graduates during this transitional time. For example, how familial support can complement professional support from school and the workplace. Any of the team members want to take this question, or? Maybe I'll start here. So I think in line with our sort of research in other healthcare settings, family and sort of family-centered approaches are a very strong theme in this part of the world. And this is something that we haven't looked at directly, but it's a very interesting suggestion, Stephanie. Thank you very much. So we are at the moment putting together designing our survey and looking at the questions that we've asked previously and whether the skills are working the way we want them to work, and also, what questions we want to ask, considering that we've moved to post-COVID. So perhaps the team can also think about sort of familial dimensions and how family can help young adults. Pauline, you raised your hand.
Yeah, I just want to add a points from my observations, not directly from the research project, but as my experience as an online counselor. I think acknowledgement of the stress the young graduates might be facing by the family member and provide supports whenever they need is very important. And I think just letting the graduates knowing that yes, that it's challenging and difficult and shares their own experience will be very helpful for young graduates.
Yeah. And Zoe, did you want to add something?
I was actually just going to add something very similar. I think it's mental health or mental ill health is not something that people experience at university or just at work or just at home. It's something that affects us, and all of these factors are interrelated. So if you are experiencing stress as a result of being at university, then you might take that stress home, and vice versa. So I think it's around awareness, understanding, education, support, all of those kind of things around a broader messaging and awareness raising that we can do. Also, for families, being aware of the stress indicators in your own child, in your own family. So, what are the kind of things that might be different? So if they stop doing the things that keep them well, and all of those kind of awareness things that we need to do. But I actually think there's an education piece. And actually, Stephanie, thank you. I think what we need to do is take this away, and we need to develop some resources on this around how can families best support young people transitioning into the workplace. And maybe that's where we can go next on our graduate mind map, Olga.
Yeah, thank you. And in the interest of time, because we are sort of going over 1 hour, I think there is a very interesting question from Apple. How can employers and uni staff help graduates feel more comfortable and become more proactive to seek help or seek out the resources available? I don't know if the psychologists have the answer to that.
Should I jump in?
Yeah.
So I think that's okay. There is no silver bullet to this answer, and indeed that's why the CMHA was set up, because it's around creating the right environment in which people feel safe and enabled to speak up around mental health. But I think a huge part of that is around normalization. So it's a conversation. It's not necessarily that we are speaking about mental ill health. We are talking about well-being. We are talking about things that keep us well. So bringing that conversation into everyday conversation, normalizing it, recognizing that some people may experience mental ill health, but also we all have down days and off days and all of those kind of things, and that there are things that we can do to keep us well, and also recognizing the detrimental impacts of stress and what stress can do. So, for example, we each have our own stress point, and we each have our own point at which a certain amount of deadlines and a certain amount of stress keeps us motivated. And then we each have a different point at which it triggers over into actually now we are starting to experience something that is not necessarily good stress. So I think it's about recognizing and understanding that, working together to increase awareness and understanding. And to the point Jennifer's just raised around storytelling, that's really powerful in senior leaders, for example, sharing their story. That sends the message to everyone in the organization and university that it's okay to talk about mental health, and in fact it's good, and you won't be penalized, and you won't not get a promotion because you experienced depression when you were younger. That's great, but we also need managers and everybody at every level of an organization and university to be able to reflect that message as well. So coming down from the top through every level of an organization to say, yes, what can we do to put in place to support you? So there's lots and lots of different things. And I think Hilika will also be able to help answer that question. But I think there's things that we can do at an individual level. There's things that we can do at a community level. There's things that we can do in an organization and workplace and university. And I think it's about bringing those together for the correct messaging as well.
Thank you very much, Zoe. There is clearly a lot of work that still needs to be done. And as I mentioned, the team members are very excited about what's ahead of us. So I would like to thank everyone for joining the webinar today and staying with us for over 1 hour. And if there are any further questions to any of the speakers, we could follow up by email. Yeah. Thank you very much. Bye.